Tanya Chlek.
Hi,
welcome. Welcome to the podcast. Super excited to have you here.
Thank you.
I learned from my brother that you're a very smart, intelligent young lady, and I'm sure you have a lot to offer and share with us tonight. What is your official title?
I am a strategy implementation project coordinator.
Strategy implementation project coordinator.
Blah, blah, blah.
What do these crazy smart people do? So, what do you want to start with the definition? Do you want to start with like a kind of just a little basic what you do, and then we'll go into like a more detailed?
Sure. So very basic what I do is support system-wide initiative projects.
Okay.
So there's like our primary lead on the project is usually a senior strategy implementation manager.
Mm-hmm.
So we coordinate hand in hand and we work for our internal clients, which would be internal hospital executives, directors, whoever has a project.
Okay. Whoa. Okay, so we're in a hospital.
Mm-hmm.
There's because when I'm thinking a hospital, I'm thinking the ER, I'm thinking sick people, I'm thinking a bunch of people with like diabetes, maybe somebody cut their forehead or something. So you're in a totally different part of the hospital, Totally different system. Can you talk a little bit about that? Why that exists and what that is?
Sure. So I'll kind of give like the background of like where I started and like where I came from, how I ended up here, basically. Perfect. So I finished high school, was trying to figure out what to go to school, just like everybody else, right? Me and my mom opened up the community college catalog of programs. Mm-hmm. My mom was an accountant and my favorite cousin was an accountant. I'm like, oh, that's so cool. I'm going to do that. My mom's like, don't do it. It's boring.
Okay.
And then everybody else that I know is a nurse. And I'm just like, I know I'm not going to do nursing. So I actually got an associate's in health information technology / health information management. So it's basically like medical records keeping.
Okay.
Super entry level, basic kind of stuff that I never got a job in because it wasn't interesting. Whatever, did other stuff. So
hold up. You wasted time in college. Guys, if you're like Tanya, you better be listening to this podcast. Okay, go on.
First things first, time is never wasted. Okay. Everything is an experience, right?
Ooh, okay, I take that back.
Lesson learned.
Okay.
Anything that you do, you could definitely learn from.
Don't take it for granted.
Exactly. So I kind of did other things. I definitely liked business like in general, but business is very general. Mm-hmm. So I decided to go back for a bachelor's degree, and at first it was business and then I switched it over to healthcare administration. Mm-hmm. So it's the business side of the hospital, right? And even when I was getting that degree, I didn't really know what would come out of that. Even right now, I don't know what's going to come in the future. We just kind of take it step by step. So I finished that degree. It's basically business type classes focused in healthcare. I actually got a minor in business because so many of them are the same. Mm-hmm. But you just learn the system of healthcare. There's healthcare risk. There's so many different fields within healthcare that aren't patient care. Like you're saying, what is that other world?
Right, nobody really knows because
people don't talk about it.
Yeah.
Exactly. You think hospital, you think patient care. So I am so far away from patient care. So the reason I am where I am is because the one class that really stood out to me was project management, or I think it was called healthcare planning. Mm-hmm. So I've always been kind of striving for projects, and I knew that the first step would be a project coordinator. And I was really lucky enough to end up in this department because they do really cool projects.
Okay. So what kind of projects would a hospital be doing? Or because when I'm thinking projects, I'm thinking like a construction project.
Right.
You're a project coordinator implementing. So what are you implementing?
Yeah. So I work for Sutter Health.
Okay.
In Sacramento. It's really cool that we live in Sacramento, by the way. I like it here. It's cool that Sutter is based out of Sacramento, and this is like where their corporate headquarters are. So in healthcare, in the hospital system, they have PMO offices, which stands for project management offices. Okay. So they have ITIS, project manager offices. If they want new programs, blah, 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 there's the whole IT world. We have facilities property management. So that would be the construction side. Okay. Or we have right now, they are starting a new project for protective services. They want to like upgrade the security system for employees and I think patients. So why I think my department is cool. So any like organization, well, I don't want to say any, our organization,
Mm-hmm.
they do like a 5-10 year plan, right? That department is strategy and business development. So they do like long-term planning.
Mm-hmm.
And then basically there's a few other departments. We're the ones who are implementing that strategy that they decide on.
Okay, so
They
there's a
pick.
department. They think of a plan or a strategy.
Mm-hmm.
They pass it down to you guys.
Kind of. So in between them and us, there's a few different steps that happen. But we have like main goals, our main initiatives. Like right now we have 4 key results. We want to be more safe, have more access for patients, make it more personal.
Mm-hmm.
And I think the other one was associated with quality. So these are our 4 like key goals. And then there's so many projects associated with it. Like I think my department touches, I don't want to make it up, but like 60 or 70 different projects, and we have about 25 people.
Wow.
So the reason that or how we get a project is some type of executive or leadership. They have a department. So I'm on a safety project.
Mm-hmm.
So the Department of Patient Safety has this initiative of zero harm.
Mm-hmm.
And sorry if I'm getting too wordy. If you have any questions,
No. I like this because
it's like deep in my world.
yeah, no. I like this. So you're saying like safety, is this patient safety in the hospital? Like what are we protecting? Who are we protecting and from what?
Yeah, patient safety and employee safety. So
So like wet floor sign. Like I'm thinking like a wet floor sign in the hallway.
Okay, so
Are we talking like cybersecurity or
so we're not cyber. I have it. That's another department. It's
Okay.
crazy because there's so much. Like there's
Yeah.
so many different people. Like they say, it takes a village. Just a random little side note. I think out of the hospital system, 20% is administration. So 80% is actual like clinical care, like the hospital that you think of. 20%. So 1 out of every 5 people that work in the hospital aren't touching patients. You know.
Right, okay.
So it's a huge world outside of patient care.
Yeah.
So safety. Okay, so going back to the projects that we do, they're system level projects. So it's not one hospital. It's not Sutter Roseville. It's not Sutter Sacramento. It's we want to change something that touches all of the hospitals, and that's when our department gets involved.
Okay.
So with safety, we're actually trying to change the culture of the organization.
Okay.
So they did a really big campaign on like they trained the entire 55,000 employees in this kind of methodology of like thinking and speaking up for safety. I started school and I'm just like thinking about all the studies, blah, 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 blah.
Yeah.
Basically, human error is really big. It's just real. We're humans. And in the hospital, like doctors are smart, but people are humans and they make mistakes. So if a hospital or if a nurse or a medical assistant sees like a doctor doing something, they should feel comfortable to be able to speak up to make sure that that patient isn't harmed.
Okay.
So to change that culture, everybody just assumes the doctor knows everything.
Right.
A lot of people assume that everybody else knows something.
And they don't question them.
Yeah. And that's what we're trying to change.
Okay.
So it's not our projects are usually like 1, 2, 3, 4 years. They're not like a few months.
Okay. Well, yeah, training 55,000 people is one job, and then you can train them, but then making sure that this training changes the culture and you enforce it. Like, so you come up with a way to change the culture.
So
Or how do you implement or like? So you sit down. You're like, they say, Tanya, implement the safety thing. You sit down and you like text everybody, hey, be safe. Obviously not. If it was that easy.
Yeah, no, it takes a village. I'm like one little tadpole in this huge pond of like people who are working on just this one project. So there's a consultant group. So again, this is very specific to my project and our department. We do a lot of different things. We hired a consulting group who kind of analyzed where we are, our current state, and gave us like a future state of where we should go to. So we have an ideal goal of where we want to end up, being zero harm. This project is really interesting to me. Zero, or it's called high reliability. It's common in the nuclear industry and the airline industry. It's very high risk and you can't have any fatalities. Like if you hear something about airline crash, like that's big news.
Right.
But like healthcare, they're trying to apply that to healthcare because you shouldn't be hearing that kind of stuff either.
That's pretty good because every day there's something that happens.
Yeah, it's it's pretty crazy. Actually, like for everybody listening to this, like as a patient in healthcare, speak up. If you see something, like don't assume the doctor knows everything, or like make sure they do know what they're talking about.
Yeah.
Because we're all human, people make mistakes.
And so sometimes we probably tend to trust them just because we think, oh, he's a doctor, super smart, or she's a doctor.
Yeah. And I mean, like, trust your doctor. They do have that knowledge. But we're here to help each other out, so we cross-check each other.
Yeah. Checks and balances.
Exactly.
Okay, so project coordinator implement. So let's go back to the implement.
Sure.
Implements. How do you? I'm just thinking, like, how do you implement something in like 10 different hospitals? Like, or maybe we don't need the details of how you implement it, but like, how do you go about strategizing like a campaign? Would be like a campaign.
Yeah.
You know,
it is.
like you can't just post posters everywhere. I mean, that's part of it.
So within our project, we have like different like breakdowns. We call them work streams. So we have one that's specific to communications, and like for an example, the organization sends out different like newsletters, like in your email, like this one comes from the CEO on a quarterly basis, or this comes this time. So we have a communications partner who puts together editorials or like columns for us, and we kind of like not slip in, but we strategically place our messaging throughout the year. So that way we call it surround sound. You start building this like, oh, I remember hearing that in training. Oh, this is working in that organization. Like you learn from each other, you hear from each other, you share stories about it. And like you were saying, send a text message out. We actually did a social media campaign. We have an internal social media platform. It's called Team Sutter. So for like a month straight, every week we would like remind people or share stories about the tools. We call them error prevention tools, to help promote them and remind people of them and create that surround sound to slowly but surely change the culture. And the cool thing is, so I think this is like year 2 going on year 3 of this project. With everything, you need to have metrics, so you know like where you started from and where you're ending up, and like to see where your progress is. So we want to see serious safety events, that's like harm caused to patients, going down. Obviously, we don't, zero harm is our goal. We also want to see that people are reporting patient safety events. So like near misses, like, hey, somebody wrote down the wrong medication, but we caught it before it was given to the patient, you know? So we want to see that going down. And then the other metric is employee safety, how many like claims are made. And we're trending in the right direction. Right now, we're just like capturing the data over 2 years. Hey, this is like what we started with. Based on this information, we want to improve on it. And even now, over the 2 years, we're already seeing improvements. Wow, so the culture's changing. So it's really cool. That's really exciting work.
That is cool. I mean, there's nothing more encouraging than seeing results of your work and of your project. So we talked a little bit about what your job is. So it changes depending on the project, which is kind of pretty cool if anybody's looking for a job that's changing and not the same. I mean, you were saying your project does take a couple years, but you're working on multiple projects, right? So you're not doing the same thing all the time, which is pretty interesting.
That's actually exactly why I wanted to do it. I started in this department about a year ago, and before that, I was working in accounts payable. And because our hospital is so big, we kind of made up this term. We called it a white collar factory because it's like the building that I used to work in, everybody has a job, but everybody does just this one tiny piece of like the assembly line. It's not a physical assembly line. It's all like computerized, blah, 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 blah.
Yeah.
But you do that one piece and you just do it over and over again. And that drove me crazy. So I was so happy to get this job. But again, I'm at the very bottom of the totem pole, just like helping out really smart people. But it's really cool because you're always doing something different. It's not every day is different. I have a project plan that I manage, but by project that changes depending on what our clients' needs are. So that's what really interested me about project management.
Okay, so that answers the why. A little bit of where you are specifically now. You talked a little bit about the why of why you decided to go into the administration side. Why did you not like the patient care side? Like what made you want to steer away from that?
That's a good question. I think when I started college, I was just intimidated by it. Even just like the RN program. I mean, not being like super exposed to it, I was kind of like, not interested, you
Right.
know?
And some people may be the one that, just like I did, when I think of a hospital, I think of all I think is of patient care, and they're like, well, if I want to work for the hospital, I guess I have to be an RN, and that's the only place that makes money, right?
Well, they
But
make
there
good
is
money.
this, huh?
They make good money.
They do make good money, but there is also this administration side. Well, yes, at the beginning you're not going to make as much money, but moving up in the totem pole, like you were talking about, there's opportunities to grow, and so maybe let's talk a little bit about that in this in the hospital administration side. Opportunities to grow. Are there those opportunities to grow? How quick can somebody move up, or is it dependent on your skills? Is it dependent on kind of what you want and what you're open to?
Yeah, that's a good question. So I want to elaborate a little bit more on the why. So I think people tend to go for nursing because for one reason, it's really good money and short amount of school. And you kind of like look at your return on investment. I'm going to invest 2-3 years in school and I'm going to start making this much. But I think another reason that people do nursing is that they actually like want to do good, right? You're helping
Right.
people, sick people out.
Yeah.
And that's another reason why I really like my job, because at the end of the day, I am helping people out. I am helping improve the system. And like, I'm really into lean or like reducing waste. And I hate inefficiency. Like if you can see a better way to do something, why not do it that way?
Yeah.
For an example, my little brother was in the hospital and he had an infection. He got discharged and the doctor's like, okay, call this number if anything happens. His fever spikes, blah, blah, blah. My mom called him about a question. She couldn't get a hold of anybody. And it's like, why is that process or that system broken? So that's why I do what I do, because I want to make sure that all the processes are as best as they can be and not broken.
Okay.
So that's the cool thing about nursing. That's the cool thing about working for healthcare in general. And that's the cool thing about healthcare administration, because you are helping improve the system. So
At the end of the day, the patients are benefiting.
yeah, exactly. You're helping people out and you're making a difference. So your question was growth. So I think that there is growth wherever you go, as long as you work hard. And I remember one professor told me, just have integrity, and I think it was trust. Just be honest and trustworthy in all that you do. And I think if you're not lazy, if you work hard, people are going to see that and people notice that. And like, I'm trying to think the difference between like a clinical side. Clinical is a little bit harder because everybody has licensure. But like in the business, marketing, like not licensed fields, I guess,
Right.
it's a little bit different. So for myself, I know that there are definitely plenty of project managers with bachelor's degrees. I think some of them don't even have bachelor's degrees. There's a certification, the PMP certification. I think we might have talked about it before. Project management professional. So it's recognized globally. So if you pass that test, like you're it for project management.
Yeah.
You get the system and the methodology just for like managing projects. So that really helps you if you want to move up within project management. And there's like a bunch of different licenses. I've noticed people, like if they specialize in something, for an example, I work with the patient safety team. There's like certificates out there for that. And I think that helps you with moving on up. Yeah, that's all that comes to mind.
Okay, so I mean, so there's definitely room to grow inside the administration. Yeah.
I have a thought. Sorry,
Yeah,
before I lose it.
No, it's okay.
When I finished school, my bachelor's degree, I assumed that, okay, this is it. I finished school. I'm going to get whatever job I want. I'm not going to do any certificates, licensures, blah, blah. I don't need it because I finished school.
Right.
My mindset has definitely changed since then.
Okay.
So I just want to like let others know that it's not it. When you finish school, you need
It's the beginning.
It's just the beginning. Yeah. You need to have experience. So that's where like the few years of like interning or just taking like entry level jobs, you're definitely going to need to do that. And certificates are big. People definitely notice that. Like lean, I was mentioning that. I grabbed a course. I never did the exam. So maybe I'll do that in the future. And that's very helpful if you're like a specialized.
I know some people look down on certificates. Oh, that's just a certificate. It's not a degree. But certificates, now I understand that certificates just mean that it's just a little bit more specialized. It's not as general.
Exactly.
So it's a benefit especially if you know where you want to go, and there are certificates that are provided in schools or different programs, and you can be certified. I mean, it can only help.
Yeah, for sure.
So we started talking about a little bit of the a little bit about the how can I part already. So prereqs. Let's jump in high school. I know some high schools have different programs.
Hmm.
Did you take certain classes maybe in high school prereqs and no?
No.
So you just got your regular GE. You went to
Local community college.
local community college, and you got what was the degree you got in?
So I got associates. It's HIM,
Uh huh.
Health Information Technology
Okay.
/ Management.
Okay.
They have bachelors in that too, but again, that's very specific to like managing the records,
Mm-hmm.
like healthcare records. Um,
So okay, so there's those jobs. If you knew about this position right now, right, and say maybe you're a director of the program now, or you're a project manager, and you're looking to hire somebody,
mhm.
what would you be looking for? What kind of experience? What kind of certificates? What kind of degrees? What would you be looking for in a person to hire them for this position?
Yeah, that's a really good question because I don't think from the perspective of a manager of like a hiring. I just think of just how to keep moving forward.
I mean, okay, so you know where you're at in your
Mhm.
position,
Mhm.
and you probably know what it takes to be successful in your position to be effective. So if you're hiring somebody's looking for a job, what are you looking for? How can someone prepare themselves?
Um, well, I'm gonna say first off that networking is pretty big. Um, that really helps. I know that's
Mm-hmm.
not a certificate, but I've gotten all the positions that I've gotten only because I knew somebody who got me an interview. And then once I was in the interview, I was like, that's on you.
Yeah.
So that's really big. And I know like in the American culture, it's really big on to go like to a specific college. And just because you go to that college, that helps. And you build
Mm-hmm.
that networking system. Or for example, my husband, when he was in college, he was part of the Beta Alpha Psi club. So it's like
Mm-hmm.
finance and accounting, I think. Because he built that network, he was able to get an internship, so he was able to get a job.
Mm-hmm.
For myself, I didn't build a network here, so I had to start with entry level positions, which you meet people, you network a little bit, move around, gain experience, and now I've gone to somewhere closer to where I want to be.
Mm-hmm.
So networking is really big in your success wherever you go, whichever path you take.
This one guy, man, I don't remember who told me this, but he says no matter who the person is, don't take any relationship for granted.
That's
Sometimes
interesting.
you might not like this person, or like,
Hmm.
ah, this guy is, I don't like this about him, but you don't know where that relationship can take you. So just
It's good
pay your
advice.
respect
Yeah,
and keep doing your thing.
yeah, for sure. So project coordinator, I'm trying to think of like even my coworkers, like what kind of backgrounds they have. I know one guy has like a political science degree, somebody else has just a business degree, somebody else has finance. I think a few others have healthcare. Um, so there's no set one path. That's actually
Mm-hmm.
one thing that I learned. When I was studying for my bachelor's, we had to interview somebody who was a risk manager in a hospital.
Mm-hmm.
And I think they had an RN background. That's actually really big in like higher level administrations. If you have like a master's in nursing, they want you because you understand how the floor operates big time. But at the same time, like to have something I'm learning about in school right now,
Mm-hmm.
having too many clinical people on like a board or like higher level like decision making
Mm-hmm.
team,
Mm-hmm.
um, you need to have a balance. You can't have them
Yeah.
all clinical and you can't have them all non-clinical because you need
Mm-hmm.
to have both perspectives because clinical people are experts in that
Mm-hmm.
and then administrative people are experts on the business side. So going back to I interviewed somebody who was a risk manager. I
Mm-hmm.
think they had like a RN background and like as I was going through my career journey, I asked a lot of people like kind of how did you get to where you are? And everybody's path is so different. And
Okay.
that's why I don't have like a set career goal either because I don't know where I'm gonna end up one
Right.
day. So I think that's encouraging for those who don't really know. Just keep working
Yeah.
hard.
Just keep working hard and
Yeah.
you'll move as long as you're going up and
Hmm.
moving up. Okay. Well, that is encouraging. Like you would say, I would be encouraged, but I'm like, man, I'm in college. I don't know what I want to be, but I could take these core classes. Like now we know a little bit about the administration side, say in a hospital. So there are these positions. Okay, well, I can start off maybe where you started off with these simpler classes, get an entry level job, and just grow through experience. Or if I know exactly what I want to be, because maybe I've listened to this podcast, or I have relatives that have certain specific, things, and I want to be in administration or whatever. I could take certain classes, like, and you were saying all these certificates. If you know you want to be in project management, every industry needs a project manager.
This is so true.
So it depends just what industry you want to go to. So if you get a degree in project managing, you'll
have a job.
Yeah, the sky is the limit.
Absolutely, I agree.
It just goes up to like what you want to do with that.
Mm-hmm.
So thank you for coming on, Tanya. That was I really liked it. It was right to the point, nice and clear cut. Talked a little bit about the administration side of the hospital, which I definitely learned about, because like I said, it was all, I usually think about patient care.
Mm-hmm.
So that's interesting. If you guys have questions, send them to me and I'll forward them to Tanya, and I think she'll be happy to share if you guys have specific questions. I mean, I'm sure wherever you guys live, there's different programs in your colleges, community colleges, universities, or whatever. Once again, thank you.
Yeah.
And take it easy.
Thank you.